Dr. Ebru Salcioglu is a clinical psychologist at the Center for Behavioral Studies and Therapies and joins us from here in Istanbul. Doctor, thank you so much for your time. To save you the trouble, let's just list some of the initial reactions to trauma. Exhaustion, confusion, sadness, anxiety, agitation, and confusion. Just some. But how long can those effects last?
They can last for years, unfortunately. The studies that we conducted after the 1999 earthquakes in Turkey, we found out that 40% of the people suffered from these reactions and traumatic stress problems up until the fourth year after the traumatic events associated with the earthquakes. And in a study that we conducted 14 years later after the Düzce earthquake that hit Turkey in November 1999, around 12% of the survivors still had traumatic stress problems. So if left untreated, these psychological effects linger.
It's going to be difficult to treat tens of thousands, maybe millions of people. How are they going to get that assistance? And do they have to get it immediately, or can it come in a few months' time when maybe it's their turn?
Well, actually, we are still in the acute phase of the trauma. So as long as the earthquakes and aftershocks are going on, we will be stuck in this acute phase. So anything that we will be doing during this phase will be for prevention purposes. So we can offer therapy just to prevent some psychological problems to become chronic. But after that, after some months, we will be seeing more chronic problems lingering in people, and then we will provide them treatment. And true, it is difficult to provide treatment to all survivors, and therefore we need an effective mental health care model that will address the problems of such a large population.
Now, what do children need specifically to help them through such an event? How much more psychologically vulnerable is a child compared to an adult?
Well, children are resilient in some sense, but they are also vulnerable. There are so many children who lost their parents because of the earthquakes, and they will need to be taken care of. Very specialized approaches or treatment procedures will be needed for some of them. Not all of them, but for some of them. For the others who didn't go through any loss, still they will be suffering from earthquake-related emotional reactions, most prominently fear. We know from studies that perhaps 1/3 of children have this fear reaction in a very prolonged period of time, such as, I don't know, maybe up to 3 years after the earthquake. So fear is prevalent, and avoidance behaviors are prevalent, because most people, both adults and children, they resort to avoidance behaviors to manage excessive fear.
And so it's important to get them back into school and socializing with other children as quickly as possible. We've seen some examples of where temporary schools have been set up, but there are millions of children affected by these earthquakes. And at the moment, they're not, obviously, most of them back at school. But that's critical, is it, to get them back doing their normal activities?
Definitely. Many people are dealing with life stressors right now, but it is very important for them to get back to their normal routines as much as possible. Even if they live in shelters, camps, some normalcy can be built in this life as well. So as long as people live a normal life, they can develop a sense of control over their lives. This is also true for children. Schools are very important for them to nurture such a normal life, because schools offer a structure within which children can interact with each other, can interact with their teachers, and such a structure can bring structure to their life as well. Children also need to feel protected and need trust in their lives. So school can be very helpful in restoring a sense of trust and sense of safety to children.
Dr. Ebru Salcioglu, thank you so much for your time.
Thank you.
Our correspondent